cared for us.
Responding to this growing need is the Care for Aging Sisters Association in Kenya, Casak.
When Casak, Care for Aging Sisters Association of Kenya, was first established in 2022, we were responding to a very simple question that arose among the member religious women congregations. Who will care for those who cared for us? Who will care for those who cared for us? Across Kenya, we found elderly religious women who have dedicated their total life to the service in education, in medicine, in pastoral, in catechesis. In all our schools, sisters who formed us, they were praying silently in their own communities. And as they aged, many required specialized care and compassionate care.
Through specialized caregiver training, advocacy and collaboration, Casak is equipping caregivers with the knowledge and practical skills needed to provide quality, person-centered care for older persons.
My name is Cheswa. I'm coming from Zambia.
I'm Sister Meriroda, a Felician sister here in Kenya.
My name is Sylvia Polokoso Ngosa. I'm from Zambia.
My name is Sister Helen, Missionary Benedictine Sisters.
The program recognizes that caring for the elderly goes beyond meeting physical needs.
And I came to do the geriatric course, which was a 6-month program, and I have found it very, very, very beneficial.
I'm a medical doctor. I've been working for the past 30 years or so. But I really felt I learned a lot from this training. More so was the networking amongst the students. There was so much to share because all of us brought in our experience and shared, what we were going through.
I live in Nanyuki, where we have a hospital called Huruma Hospital. I joined there just recently on February after changing my apostolate. And coincidentally, I was asked whether I would wish to have a course on geriatric. And it was just a joy to me that being sent in the hospital in charge of patient care, I now have the knowledge on how to cater for the needs of the elderly, the sick, and also to support them emotionally.
Through partnership, innovation and shared responsibility, Casak is helping shape a future where aging is not viewed as a burden, but as a stage of life that deserves honor, dignity and the highest quality of care.
I joined a geriatrics course, that's from January, after even going through the university, so that I can calm down, because you realize the elderly, they're somehow getting neglected in our country.
I really found enriching was the experience when we went to Nyumba Yawaze. I've said it correct?
Yes.
Yeah.
We came for the 2 weeks experience at the old people's home called Nyumba Yawaze, and we had the other practicals at St. Francis Hospital.
Because there we saw firsthand how the little sisters are taking care of the aged. And it was very good also to interact with the elderly people that we found there, and we learned a lot of lessons from there.
I am really grateful that I was able to learn the basics of taking care of the elderly in our society, because these elderly people really, really matter.
People may forget what you said, what you did, but they will never forget how you made them feel when you were with them. It is a response to one of the most pressing and often overlooked need within our religious communities today, the care of the elderly sisters and brothers, and I want to say not just elderly, the care for the vulnerable. And we know that even ourselves we can be vulnerable, isn't it? Yeah. Sometimes I feel vulnerable, so I need the care also.
Old age is not a disease. It's a condition that all of us will one day reach. And if we are able to take care of them and give them the respect, the dignity, consider their wishes and not force things on them, I think we'll make this place a better place for themselves and for us as well.
It is a good opportunity given to us by Casak that we may be able to enlighten the community or the society on taking care of the vulnerable, how to treat them when they are sick, and also meeting their needs.
I would advise any other medic, either a nurse or even another person who takes care of the elderly in our country. They should be able to take this course, geriatrics, so that in a way we may bring that holistic care, sympathetic care, it's empathetic, I would say, spiritual care, and then we combine with the care for the doctors together, that they also feel accepted.
Together, we are ensuring that every aging sister and every older person can live with dignity, purpose and hope. This is the vision of Casak, building dignified, compassionate and sustainable systems of care for aging communities.
I would really encourage this course to be done all over the world, because I think we need to care for our elderly. We are where we are because of them.